Today we're doing a session on the myths and misconceptions of endometriosis. So today with Dr. Shakiba, we thought we'd go over some of the myths and offer explanations. Speaking of endometriosis and where it's located in the pelvis, if a patient is having severe bladder pain or they're having a lot of problems with their bowels, does that mean that the endometriosis is inside the bladder or inside the bowels?
Well, that's actually a very good question, and that's another myth about endometriosis, that the bladder symptom it not necessarily mean that endometriosis is sitting on the bladder. Bladder could be completely normal and have zero involvement, and the patient still have the symptom. And the reason is the nerve that go to the bladder have a problem. So the best example for it would be the light bulb and the wire in the wall. So if there is a problem in the wire behind the wall, that light bulb is still gonna dysfunction, not gonna work normally. Same concept apply here. So not necessarily always is the light bulb problem. Sometimes it's the wiring in the wall. And in the case of endometriosis, based on our experience, we see a lot of this. I mean, patient have a bowel symptom, but there is nothing wrong with the bowel. And we see there is an implant sitting on the nerve. Once we remove it, the bowel symptom goes away. And we're actually publishing a paper in this regard, especially about the bladder. So again, take-home message is you have a bladder problem and your known case of endometriosis not necessarily mean endo is sitting on that organ.
So what you're saying, these things are all connected through the pelvic nerves, which is how you get bladder symptoms, bowel symptoms.
Exactly. If many organs in the same neighborhood are affected at the same time, only thing that makes sense, you have to see what is in common in between all these organs. And the only thing common among all of them is a nerve, and that nerve called inferior hypogastric plexus that feed all these organs. So you have to go after that nerve and see what is going wrong with that. And in the case of endometriosis is the again implant of endo causing neuroinflammation on those network of nerve. Please let us know if you have any question. You can always put on the comment and or reach out to our office if you have any additional questions.